Good morning, good afternoon, good evening, whenever you happen to be joining us, and welcome to Adding Value to Your Conversation, Simplifying OTC and Nutrient Conundrums. My name is Bradley Henricks. I'm a registered nurse and a certified diabetes care and education specialist. I work at McLean Children's Pediatric Endocrinology, which is part of Baylor Scott and White Health system. I'm joined today by two amazing, fantastic CDCESs, Becky Sulik, who is a registered and licensed dietitian. Becky works at Rocky Mountain Diabetes Center in Idaho Falls, Idaho. She is the immediate past chair on the CBDCE Board of Directors. And I'm also joined by Nancy DeHaan, who is a registered pharmacist. Nancy works at Ascension St. John Hospital and Medical Center in Detroit. Nancy does sit on the CBDCE Board of Directors. Hopefully our presentation today will provide useful information in your discussion with patients, families, or their care teams. And so we're going to discuss basic assessment, common OTC products such as analgesics, cough and cold, and topical agents, as well as vitamins and nutritional supplements. Nancy, what are some important areas for the healthcare provider to consider when making recommendations for OTC products?
Oh, wow. So what we have here is it's not surprising that our patients are a little bit overwhelmed when trying to select a safe and effective over-the-counter product. There are over 300,000 products on the market in at least 80 different therapeutic categories. And choosing the right over-the-counter can present an even greater challenge for our persons living with diabetes. So I've listed some of the basic assessment guidelines and recommendations on this slide. First and foremost, we need to gather some information around exactly what is the problem and how can we help. What are the chief symptoms or complaints that you're going to need to target? And are there any underlying conditions that we should know about? Sometimes just asking what types of prescription medications are taken will help in identifying any health issues or other comorbidities. Next, we need to look at the active ingredients. Is there only one primary active ingredient, or is this a combination of two or more components? Then check for any listed warnings or contraindications that might preclude us from recommending the product. This is really important as many of our clients are not just being treated for diabetes. Let's go back to that second bullet point in a little more detail. When evaluating an OTC medication with more than one active ingredient, we need to consider two things. First, are both or all active ingredients necessary to address the current symptoms? We want to avoid multi-symptom products that may contain unnecessary components. Read the box label and determine whether all targeted problems match patient complaints. An example would be, if you only have head congestion and a headache, then you wouldn't choose a product that also addresses chest congestion or a cough. The second consideration is to avoid duplication of therapeutic classes. For example, taking two different antihistamines or two different analgesics in tandem. With so many OTCs available, it's easy for both you, the healthcare provider, and our patients to miss this overlap. Consider what your client is already taking at home and then select a product that adds additional benefit without duplication or risk of hazard. I find that sometimes just getting something with a singular component product, it will allow the person to tweak their home therapy as different symptoms start to resolve. Next, we need to look at the dosage forms that are available. Typically, we know that adults prefer tablets and capsules, but not everyone can tolerate those hard dosage forms. There are liquids and syrups available, but they present another problem in that they might contain added sugars and alcohol, which can further elevate blood glucose levels in someone who may already be experiencing stress-induced hyperglycemia from the illness they're trying to address. But then, should we then always recommend a sugar-free product? Not necessarily, because I'd rather that my patient take a cough suppressant with sugar in it that would afford them a good night's sleep than stay up all night coughing. So I'm going to ask Becky, you and Brad to cover those next few bullet points.
So I, as a diabetes educator and care specialist, I usually try to make sure that each patient has a very individualized sick day plan, management plan based on their treatment plan, the different meds they're taking and so forth. And that plan should include, nutrition information or tips for them to follow on a sick day, as well as hydration instructions, how to stay hydrated and avoid dehydration. What about you, Brad?
Yeah, I completely agree. And I think, the big thing is making sure that, our patients or persons with diabetes know who to contact when and if questions come up. I think for a lot of times, we may discuss sick day management and have these discussions, but it may be, a prolonged time before some of our patients may actually run into an illness or have, a situation come up where they need to use this information. So I think it's important to have that ongoing dialogue, but also to be aware of, making sure that we need to have a way for them to reach out to us so that we can discuss this whenever illnesses do pop up, since it may be an extended amount of time since we originally had covered that. Moving on, let's explore some commonly used OTC classes. Nancy, I know analgesics are often used for a wide variety of issues, some related to acute onset illness, while others may be used to address chronic underlying conditions. What can you tell us about this class?
Okay, so over-the-counter analgesics are very commonly used, not just in our patient populations, but in the general population. And this slide is going to review some of the differences between acetaminophen and nonsteroidal anti-inflammatory agents. While acetaminophen will help to reduce pain and fever, it does not provide the added anti-inflammatory benefits that you'll get with the NSAID class. So dosing for each is also an important consideration. We want to determine what other medications the patients may be taking, both prescription and over the counter. And this goes back to avoiding duplication of therapy, as well as possible contraindications or some drug-drug interactions. We need to know how long they plan to continue the use of these medications. Are they looking at short-term or long-term use? And at what dosages they're planning to take them. We know there are toxicities associated with long-term or high-dose use with each of these classes, and I've listed some of those on the slide. Typically, they're safe for short-term use if there are no contraindications, but for chronic users, I always refer them for a discussion with their primary care provider so they can be monitored and have their labs checked periodically. And remember, this may present an opportunity for you as a diabetes specialist to suggest possibly some over-the-counter topical analgesics for relief. Brad, Becky, I don't know if you want to add a few comments.
I think you covered it great. Thank you.
Yeah, I think so as well. Let's go ahead and take a look into another commonly used category of OTCs, those used for cough and cold symptoms. What can you tell us about this class?
So this slide lists some of the most common active ingredients used to address some of those multi-symptom ailments that we see. So guaifenesin, as we know, is an expectorant. That means that it targets chest congestion. It helps to break up the mucus that line the airways and the lungs. It does not cause drowsiness. It's not contraindicated typically in people with diabetes. It works best when used in combination with plenty of clear, and I stress clear liquids, to help break up mucus in the airways. Dextromethorphan is a cough suppressant. It's available in liquid or solid forms. It's oftentimes manufactured in combination with guaifenesin. So you're going to get the benefits of both the expectorant and the cough suppression. Dextromethorphan is associated with side effects, especially in higher doses. and it does have the potential for abuse. It's usually effective, but if the cough persists, a referral to the primary care provider may be warranted. In some states, over-the-counter codeine products may be available, but I caution my patients who are self-treating with codeine to use it only at night, because we find that around-the-clock use of codeine can relax the cilia in the air tracts, which causes the mucus to settle in the lungs, putting the patient at an increased risk for pneumonia. There are several nasal products available. Of course, the safest are going to be your saline washes and your saline sprays, which will help to moisturize the nares and the nasal tract. And these can be used as often as needed. Nasal steroids are also available for short-term use to help calm some inflamed nasal membranes from cold or allergy. And then we have the nasal decongestants, which are, although they're inhaled, they are systemically absorbed and can affect blood pressure, heart rate, and increase our blood glucose levels. You'll see contraindications on the boxes for patients with diabetes or underlying cardiovascular related conditions. When they are approved by the primary care provider, then I would suggest limit use to not more than 3 consecutive days to avoid rebound congestion, which can be difficult, very difficult to reverse. If we move on to the next slide for cough, cold, and including allergy, oral antihistamines are available for symptoms to include things like itchy, watery eyes, runny nose, and sneezing. They're available in some of the older formulations, which are really associated with pronounced drowsy side effects, ergo the reason some of them are used as sleep aids, and the newer non-drowsy products that I've listed here. Typically available in liquid, tablets, and capsules, but there are some nasal sprays available. These products are designed to dry the sinuses and the mucous membranes. Antihistamines don't affect blood pressure or heart rate, but because they can dry the airways, they may promote wheezing and shortness of breath in patients with underlying COPD or non-allergy related asthma. The drowsy formulations should also be used in caution in some of our elderly patients where they could promote falls. So we talked about the nasal decongestant sprays in the earlier slide. Here I've listed some of the oral nasal decongestants. Phenylephrine can be purchased in the OTC aisle, while pseudoephedrine is behind the prescription counter and requires both identification with the purchase, and there are quantity limitations enforced by the Drug Enforcement Agency. This class of medication is associated with increases in glucose, again, blood pressure, and heart rate, and when taken in the evening can cause a lot of restlessness, resulting in poor sleep. Of the two, pseudoephedrine is typically more effective, but is associated with much more pronounced side effects, as I just mentioned. These medications will have warnings and should only be recommended by a primary care provider. I don't know if you guys have anything else to add.
That was really great information. Thanks, Nancy.
Yeah, I agree. That's wonderful information. I think it's, it's certainly worth emphasizing the impacts of, on glucose, blood pressure, and heart rate of both the oral and nasal spray decongestants. So I think a lot of times patients can easily overlook those impacts when using those products. Let's move on to another popular category of OTCs, topical agents. This is another broad category with multiple products that leads to much confusion. Nancy, I see you have listed topical antibiotics first. These are intended to treat or prevent skin infections. What can you tell our listeners to help them with recommendations with these products?
So I did list the 3 most common topical antibiotics: bacitracin, polymyxin, and neomycin. They're available either alone or in combination with 2 or 3 of these components. You'll find a lot of people purchasing the triple antibiotic product over the counter. They're all individually effective. There's a little bit of literature that states that the 3 in combination are more effective in treating, and the two individual components, the bacitracin or polymyxin, are more of a preventative, like in a post-op wound infection, to prevent the infection from happening. But there's no literature that states that any one of these is more effective than the other. Some physicians may shy away from ordering the triple antibiotic product because of the three components. Neomycin is probably the most likely to cause an allergic reaction, but I will say that that is pretty rare. As far as recommending creams or ointment, here's the scoop. Ointments tend to be a little stronger than creams, especially when you're talking about things like steroids. They're greasy, so you're not necessarily going to want to use them on your face when you're going out in public, and they can stain clothing, but they tend to be more soothing on open wounds. While creams can be rubbed into the skin more easily, they are harsher on irritated skin or abrasions, and patients may complain that they burn a bit. When applying a topical product, typically more is not necessarily better. So I usually recommend a thin application 2 or 3 times a day, and find that that is more effective than putting on thick gobs of cream or ointment. I listed some of the steroid and antihistamine topical agents next. These can be used for itchy skin, rashes, hives, and the like. And OTC hydrocortisone or diphenhydramine are available for things like minor skin flares, allergic reactions, eczema, poison ivy, poison oak, things like that. Be sure to rule out, though, that there are other possible causes, things like shingles, chemical burns, and avoid use of steroids on the eyelids or getting things like Benadryl in open blisters. Bradley, I think you were going to take the next couple bullet points.
Yeah, absolutely. So talking about moisturizers play an important role in the care for a person with diabetes. Let's explore that in a little bit more detail. So moisturizers are available generally in 2 different forms, creams and lotions. The big difference being that creams are thicker than lotions. However, for larger areas, lotions are generally much easier to apply and spread over the area. It is recommended to use fragrance-free or non-scented products. So it's important to emphasize checking the label to make sure that those aren't included in a product. Common ingredients may include urea, ammonium lactate, and ceramides. And when applying, avoid areas where moisture can collect and that could result in a yeast or a fungal infection. Over-the-counter moisturizers are important in the prevention of foot problems. Dry skin can result in fissures where bacteria and fungi can invade and cause an infection. So definitely with any site of infection, it is really important to make sure that we're referring our patients back to see their physician or doctor to get that evaluated to make sure that gets treated appropriately. Antifungal creams or powders are also available over the counter. To list a couple, such as meconazole or clotrimazole. These agents are typically used for infections between the toes, on the feet, or possibly on the groin or vaginal infections. And kind of switching gears here, of course, technology continue to see it advance, and we see more and more individuals wearing devices such as continuous glucose monitors, insulin pumps, and different adhesive issues that may arise with these things. So Becky, what are some of your recommendations in regards to these devices?
Thanks. I find that one of the most common challenges we encounter for people wearing these devices is that the adhesives that are used to put the tape and the sticker and so forth to have them adhere to the body sometimes can cause skin irritation or even early allergic reactions, skin reactions, and things like that. And so there are some things that we can do to help with that. I just wanted to point out that using one of the items that Nancy mentioned earlier, the oral steroid spray Flonase or a similar to that can be sprayed on the site before inserting the sensor or the barrier wipe or whatever, and that can help reduce the allergic reaction if that's what's happening there. Also using a barrier wipe, such as Skin Tack, or there's a whole bunch of them that you can choose from, or even using an under patch that are available. And you need to follow the manufacturer recommendations for using those, but they can be a great answer to helping people that have these problems. And there's additional information on the manufacturers' websites for these products, as well as the websites of our professional organizations.
And I'd agree with that. There's lots of good resources that are out there from the manufacturers and the professional organizations with useful tips for, a lot of these sensitive skin issues that do frequently come up. And there's also options for wipes or liquids that are, made specifically for removing adhesives as well. So such as Tack Away and other products like that. But what's also kind of worth noting is that any type of oil or oil product can also be useful in the removal of sensors or pump sites. And it also, these things can be used if you ever notice the fun little residue that the adhesive sometimes leaves behind as well. So products such as baby oil or even cooking oil, that most individuals already have around in their household is a cost-effective option for adhesive removal as well. So Becky, there seems to be a lot of interest and discussion in vitamin and mineral supplements. What are some key things to consider when discussing this with our patients or our persons with diabetes?
Yes, I would agree. As a dietitian, I get asked lots of questions. It's a very hot topic, supplements and vitamins in particular. So here's a few things that I would recommend discussing with patients. First of all, I find that some people are very sensitive about their supplement practices, and they're sometimes hesitant to share that. I try to explain and encourage them to share with their whole healthcare team, because sometimes the nutrients found in supplements can interact with medications, and that can lead to them working less well, less effective, or in a few cases, they can have actually interactions and cause some risky side effects. I think also it's important for the public to know, and as a diabetes care and education specialist, we can help inform, is that supplements are not regulated by the FDA in the same way that foods and drugs or medications are. So sometimes, it's really hard to, it's a uncharted water sometimes for our patients, and there's really no guarantee that a bottle contains what it says. So I always encourage patients to choose reputable brands. And there are actually some third-party organizations that independently test supplements. And some examples are USP and NSF. And these are programs that verify independently and test these products to say that they do indeed have what they claim to have in them. And they'll have little labels on the vitamins and supplements for those to indicate that. Another topic that comes up a lot with patients is the word natural. Sometimes people feel like natural means it's okay. And I always just like to point out that natural label on a product doesn't guarantee that it's safe or effective. So just the same caution should be used. Of course, as a dietitian, I'm a real fan of trying to get nutrients from food first. And so I encourage everyone to try to eat a variety of foods. And I think a good multivitamin I consider kind of insurance for filling in the gaps because our eating is not always ideal, of course.
Are there any specific situations where supplements are recommended by healthcare providers?
Yes, and I've listed a few here. These are some common ones, and there are certainly reasons that our healthcare providers would recommend these. And so one common one to be aware of in diabetes is that we know that people taking metformin are more likely to be deficient in vitamin B12. And so the 2023 standards of care recommend checking B12 levels for those who are taking metformin, especially if they have any anemia or symptoms of peripheral neuropathy. So I know in our clinic, this is just a routine thing that we check. And then of course, we'll supplement the B12 if indicated by the lab results. Calcium is another one that I find very commonly needed for supplementation, particularly for women. And as we age in particular too, the aging process puts at more risk for bone loss. And so I find a lot of patients are prescribed some type of calcium supplement in addition to some other medications that would help with those problems. There are a few different kinds of calcium supplements. Calcium carbonate is probably the most common one used. It is the least expensive. However, it can cause some gas and bloating and things like that. So if you have a patient that's on a calcium supplement and they happen to be complaining about that, another option would be calcium citrate. It has a little bit better absorption and less gas, bloating, constipation, and those kind of symptoms. It does cost a little bit more, but in the end, that might be a better tolerated option. Iron supplementation is also really common. There are usually I recommend people don't take iron unless the doctor has indicated, for a specific problem, anemia and so forth. Some examples of iron supplements, some of these can have different side effects and issues. Ferrous sulfate is the least expensive, but definitely has some side effects, including constipation. It can cause an upset stomach or black stools. Ferrous gluconate is one that's often more well tolerated, but again, may have a higher price tag. Some additional tips as a dietitian I give is iron is best taken on an empty stomach for improving absorption. However, taking it on that empty stomach can create some of those side effects. So I often will, if people are having those, I'll ask them to try taking it at bedtime. And sometimes that helps that problem. Also, giving vitamin C with iron helps to improve its absorption. So I, again, like to hopefully help that with food, but if a vitamin C supplement sometimes is appropriate to help improve that. Finally, vitamin D. And we're hearing a lot about vitamin D right now. The role of vitamin D in diabetes is particularly interesting, and it's a really active area of study right now. But according to the ADA 2023 standards of care, there's really more research needed to fully understand this and to to better understand if there's more population-related benefits to a group such as people with diabetes. So the 2023 standards of care, routine vitamin D supplementation is not specifically recommended. However, regular testing of vitamin D levels can help your healthcare team determine if this is needed. And I find that this is a test that we do regularly in our clinic, and then we work with that based on the results we're seeing there. And with any supplement, make sure to advise patients to take what is recommended, because more is not necessarily better.
Every time I see the picture on this slide, it just makes me smile, because I just feel like this always kind of puts us into perspective, all the things that sometimes we have to juggle, or all of our patients have to juggle when we're dealing with diabetes. But Becky, do you have any suggestions, or Nancy, about helping the person with diabetes or their caregivers be more comfortable about discussing OTC meds and supplements with their diabetes care team?
Yes, I've got a few comments here based on this graphic I've got here, and the importance of shared decision-making. Of course, that's our goal, is that we want to not just be telling the patient what to do, but involve them in the process. And part of that's helping them to feel comfortable in sharing information. So do your very best to create a safe space to discuss these things and without judgment, and kind of just look at what you're saying about the supplements and things. Try to just let them know that it's their health and their wellness that is top importance to you as you're asking these questions, and that your real desire is to help them reduce the burden of managing their diabetes and keep them healthy and feeling good from day to day as well. Any other thoughts you all have?
I would like to add just a couple things. So in the pharmacy, it's a little bit difficult sometimes to find a private area where the patient feels comfortable sharing information. So make sure that you provide them with that, as you said, a safe space. And I think sometimes the patient comes in with a preconceived notion of what they want to buy or what they think they need, because either someone told them that's what they need or they saw it on TV. So be sure to validate what they're saying, that you hear what they're saying. And if it's not the appropriate thing, help them come to the conclusion, like you said, that we're making it patient-centered. We have to bring them on board. So making sure that they feel comfortable with changing their decision.
I love that.
I don't know if Brad's muted.
Oh, sorry. Yes, I completely agree. I think that's the important thing, is making sure, that we're all on board, we're all on the same page, but also making sure that, we're keeping in mind that ultimately we're here for the patient, and we want to encourage that open dialogue and have, that rapport where the patients do feel open and feel, welcome to discuss whatever it is that they're concerned about, so that we can address those concerns and help them make the best decisions, possible.
Anybody have anything left to add? I think we're on to our
Great. I
last
think this has been a
slide.
great conversation.
Yeah, I agree.
I want to thank Cheryl from CBDCE, who has been helping us to record this webinar to be available for you all. We're hoping that all the diabetes care and education specialists benefit from this, as well as the quality coordinators. I'd like to just put in a plug for the CDCES credential. I feel like if you don't have this credential, you hopefully would consider getting it. It can help improve your confidence and your visibility, and have that recognition of the skills that you have. Our final slide here is just some information about where you can find out more. There's a QR code that you can scan.
And Becky, I'd like to thank the American Diabetes Association for giving us this opportunity to reach all of you today. I think that the messaging is very important to all of you, and it's important to us to be able to bring some information to you that we hope will be valuable.
Been our pleasure. Well, thank you everybody for joining, and be sure to visit the CBDCE website and learn more.
And reach out to us if you have any questions.
Yes.
Absolutely.
Thanks, guys.
Okay.